Hi, everyone, and welcome to the Aging in Place Work Group. I'm Krista Griffith, and I am a state representative representing the 12th District of Delaware. Senator Masvinos is unable to be with us this afternoon, so I'm assisting him by running and chairing the committee today. It's so good to see everybody. Looking forward to our work continuing. Today's February 25th. So let's start. I'll call your name, and if you could just introduce yourself, let us know why you're involved in the working group. And this is for the public who is listening. And then we'll begin our business. So I'm going to start with Wendell Alfred. Wendell, hi.
Yes, good afternoon again. Wendell Alfred. I represent the state of Delaware for AARP and very excited about being part of this group. It's really been interesting, especially our subgroup. So thank you.
Thank you, Wendell. And we're going to get to that subgroup in a little bit.
Right.
Nice to see you, Carolyn Fredericks. How are you?
I'm great, thank you. I'm Carolyn. I'm the director of the Modern Maturity Center here in Dover.
Wonderful, thank you. It's Robinson.
My name's Denise Robinson. I'm a nurse supervisor with the Division of Medicaid and Medical Assistance.
Thank you so much, Denise. Melissa Smith. Hi, Melissa.
Hi, good afternoon. Melissa Smith, Director of the Division of Services for Aging and Adults with Physical Disabilities.
Thank you. And your poinsettias, are those poinsettias behind you?
They are. Bright Spot Farms on our Herman Holloway campus. They grow the very best poinsettias. They live forever.
Yes, nice to see them still blooming. Thank you. Hi, Katie Macklin. How are you?
Good afternoon, everyone. I'm Katie Macklin with the Alzheimer's Association Delaware Valley chapter, and very excited and appreciative to be a part of this effort because unfortunately the prevalence of dementia is growing rapidly in our state, and providing support for individuals living with the disease and their caregivers is extremely important in terms of allowing people to age in place. So appreciate being a part of this effort.
Thank you so much. Hi, Maggie Webb. How are you?
I'm doing well, Representative. How are you?
Good, thanks. Good.
It started out a icy cold day, but the sun's starting to come out, so hopefully it'll look a little bit better. My name is Maggie Webb. I am the Vice President of Programs over our long-term services and supports at Easter Seals. So I work with all of those individuals that are not just at our facility-based programs, but also out in the community. So our seniors, adults with physical disabilities, anything that we can do to help support them and their families.
Excellent. Thank you, Maggie. And hi, Chris Frazier. How are you?
Hi, Representative. Thank you. I'm doing well. I'm Chris Fraser. I'm Chief Operating Officer at Westside Family Healthcare, where we do also have some of those wonderful poinsettias still growing in our offices as well. So thank you to the farm and DHSS. And I also serve on the board with Christiana Care Home Health, and just excited to bring some perspective from our communities that we serve and caring for individuals in the home as well. Thank you.
Thank you so much. And last but not least, Senator Bonini, I see you're with us. I don't see your face, but I see your name. And
well, I would say least for sure with all these great people. But I'm Colin Bonini, very blessed to be the state senator for the 16th district, which is just south of Dover. And with Magnolia, Frederica, wonderful, wonderful people. So and Representative, glad to be here. And really, it's our little work group has been great.
Yes, it has. Sorry about that. Yes, thank you. But as we all know, I forgot to silence my phone, and I apologize, Senator. Thank you. Thank you for joining us, everybody. And let's get started. The first order of business is just taking care of business, which is our meeting minutes. Has everybody had an opportunity to see the November 26th? Okay, do I have a motion to approve those meeting minutes?
I'll make a motion to approve those meeting minutes.
Motion made by Katie Macklin.
I'll second.
Second by Wendell Alfred. All in favor, please just raise your hand. Any opposed? Okay, the motion carries and the minutes of the 22nd of November are passed. And we'll go to the January 21st, 22 minutes. Has everybody had an opportunity to review those? And is there any motion?
I'll make a motion to approve the minutes.
Thank you, Melissa Smith. Any second?
I'll second those.
Thank you, Katie Macklin, for second. All in favor, raise your hands, please. Any opposed? Any abstentions? All right, the minutes passed. Okay, so we'll get right into to business. So just to update the committee, our work was supposed to have been completed a little bit earlier, but because we did a resolution before the General Assembly broke for Joint Finance Committee, we did extend our time in which we have to finalize our report for the General Assembly. So we do have some extra time, and I will get into that in a little bit about what that means. But for the moment on our agenda, the next thing that we have is a report of our aging in place subgroup. So we're going to start, if we could, Chris, with you as chair of the Social Determinants of Aging Well, Racial Disparity, and Health Equity. Can you give us an update about what your subgroup has been working on and any specific recommendations that you see on the horizon?
Thank you, Representative. On the road here, but pulled off and being safe on the report. So I apologize for being off camera a little bit earlier there. We had a committee meeting on February 10th, which was a short meeting.
Chris, I'm sorry, we seem to have lost audio for you. Can you hear me, Chris?
And
Chris, can you hear me?
It's been a good bit of time. Yes. Yes. Am I breaking up?
I'm sorry, you did a little bit, but if we start again, if you can start from the top, let's try that.
Oh, okay. All right. I apologize.
And if you need to, and if it helps,
you can hear me.
Yeah, it can hear you. And if it helps to turn your video off for this part, that's fine too. Sometimes I think that does help audio. Okay, looks like we're having some technical difficulties with Chris. So we're gonna go on and we'll come back to Chris in a minute. Looks like he disconnected too. So 21st century caregiver workforce issues. Katie, you are the chair of that committee. Can you give us an update? And Chris, we're gonna come right back to you in a little bit. We just moved to Katie. I'm sorry about that. So we'll do Katie's report.
Thank you.
Go back with you, sure.
Sure, and Senator Bonini, please feel free to jump in as well as I cover a report for our work group.
I will do, but you know what's going on, so this is great.
Okay, great. Well, thank you, and certainly Wendell as well, who's also a key member of this work group.
Oh, absolutely, absolutely.
So we, at our recent meeting, had a really great conversation as we're working to hone in on the 2 to 3 specific recommendations that we want to put forth in support of our caregiver workforce, as well as the unpaid caregiver workforce, that being our family caregivers. So, what do we know? So we know that obviously there's a growing demand for direct care, but there's not enough workers to meet this demand. We also know that direct care workers care for and support some of our state's most vulnerable, but the workforce itself is also vulnerable to low wages, harsh working conditions, and economic insecurity. So obviously there's steps that we need to take to address this need for a prepared, well-trained, and empowered direct care workforce now, as well as in the future. But we've talked a lot at our work group meeting that we've got to do something now to stop the hemorrhage, that this crisis is here with us now. So we've discussed things like strategies to recruit, retain, and advance direct care workforce pipeline, to make the field more attractive, such as through training, career pathways, and mentoring. We've also talked about strategies that encourage retention and career advancement, and really looking to respond to the needs of our growing aging population and ensure that this workforce is in place to provide care to this growing population. We've also talked a lot about that unpaid caregiver workforce, our family caregivers. They certainly play a really integral role in all of this, and it is incredibly important that we support them as well. And even as we think about the workforce crisis that we're facing, the more that we can support our family caregivers, that might also help ease the burden that we're facing in terms of the workforce, as family caregivers are more equipped and prepared to continue to provide care to the loved ones at home and feel capable and confident in being able to do so. So we have 3 bucket areas that we've sort of are focusing on with our recommendations. We still really we're still doing some work to hone in on the specifics. We certainly want these recommendations to be feasible and implementable. But I'll share what the bucket areas that we're looking at. So the first bucket being addressing the workforce crisis. And this could consist of not only increasing funding for service providers to boost staff wages, but also looking at efforts around retention, recruitment, to create career pathways and career advancements for the support to support workers. We're also looking at different means of increasing awareness of the issues and services for family caregivers. We hear a lot about, there's a lot of resources out there, but family caregivers just don't know where to go, where to turn, how to access those resources and how to navigate. So we were talking about some efforts that we could increase awareness of those services for our families in Delaware. And then also just bolstering family caregiver support, through things like respite care and training opportunities. So those are the three areas, again, that our work group is looking to focus in on in terms of our recommendations.
Madam Chair.
Yes, Senator Bonini, please.
So Katie did a fantastic job, per usual, and much better than I did. But one of the findings, first of all, it's a fantastic group, incredibly highly qualified people. With the exception of me, incredibly highly qualified people. But I think one of the really intriguing findings, and Katie and Wendell, please jump in here, I thought was sort of good news, bad news. The bad news was that not as many folks out there don't know the full scope of services that are available, and that's a communications problem. The good news is, and I think the consensus, and we have members from so many industries and private sector and advocacy and also government, was that there really is a tremendous number of services available out there, and sort of the good news, if you will, is part of the challenge is getting that information into the hands of folks who could use those services. And the bad news is we got to do that, and that's a real hurdle. But the good news is that those services are out there, and I just thought that it was sort of a consensus. And Katie, please jump in. That we really do have a pretty robust environment of services available for folks. And that's the good news. We don't have to build those from scratch. That a big part of it is simply is communicating. And then we had talked specifically about financial supports for respite care and also for the employees, and then training opportunities. So Katie is exactly right. But I think our core goal is, as Katie said, is to really focus on 2 or 3 things that we think are going to be achievable. And we got a great group, and I think we're getting there.
Agreed. Thank you, Senator Bonini.
Thank you both very much. That was terrific. And when I report on my subgroup, you're going to hear a lot of overlap. So that's why it's nice to get the reports in now, because as we're formulating, each subgroup is formulating its recommendations. It's nice to see that there's other groups concentrating on similar areas, so that together we truly are, our work is identifying where those gaps are, and what we can do as a group to get them improved. So thank you both. And Wendell, I see your hands raised. Please, sir.
Yes, thank you. If I may, for just a second, this just came out in the Wall Street Journal, but it's talking about the caregivers. I'd like to read it if you don't mind, please. But family caregivers are the backbone of the nation's long-term care system, providing an estimated $470 billion worth of free care. That's an unbelievable number, often at great personal cost. On the average, caregivers spend 26% of their own personal income on caregiving expenses. And it's just what was so fascinating about the article was that all of a sudden it's being picked up, and the things we're talking about now seem to be a nationwide problem of concern. And so one of the things, and Katie, if you don't mind me mentioning, one of the things we talked about too in our subgroup was possibly that maybe there's a way that we can communicate by getting that message out through realtors and new people moving to Delaware, through the chambers, through whatever, but also possibly of having maybe a core group of, I'm talking 5 or 10 volunteers, just much like our AARP does. We do everything through volunteerism, and that there would be a group in Newcastle County, a group in Kent County, and a group in Sussex County, and that we could help, we could be point people. I don't think this is something that would be too time consuming, but it's just a thought that we presented and discussed and kind of kicked around. But I think we're on the road to coming up with some really good solutions. Thank you for letting me interject that, but I just felt it was important.
No, it's absolutely right on target. And in fact, I was at a meeting. Many of you know I have a child with cognitive disabilities, and I was speaking with a group of parents and family members of adults with cognitive disabilities this week. And one of the core subject areas was how difficult it is when one of those parents, if there's two parents assisting an older sibling or an older child, a friend, how do you get sick? How that really does impact the structure and how damaging it can become to a family system. And I think we're seeing a lot more of this problem area because the pandemic reduced the ability for people to get into homes and assist and help each other as a community because everyone became so isolated and dependent upon themselves. And so unfortunately, even our neighbors weren't able to go help other neighbors as much as normal. So anyway, there's a lot to it. So, and that was an interesting article from the Wall Street Journal, Wendell. So I appreciate you taking the time to share that with us. Chris, are you okay if Senator Bonini, did you want to add to that?
Oh, I just said Wendell rocks, man.
He does. We all rock, this whole group. And without someone else who rocks, Chris, are you ready? Are you? Yeah.
Well, thank you. You can only rock with a great band, right? So it's everybody here. So thank you. Thank you. I'm at a safe spot and a better reception right now. Our committee met on February 10th. I want to thank everybody because it was an abbreviated meeting, but everyone held on through a little bit of technical difficulty to meet. And as you've mentioned, Representative and others here, there's quite a crossover between all of our conversations. But our committee that's looking at social determinants of health and racial disparities and health equity, for those of you who are new to our work, started to dive into the factors that really affect the social determinants of health. And we did a survey and have come up with a list of where we think the most impactful areas are and where the state has potential opportunities in line with what we've been discussing. We spent a good bit of time looking at those priorities, which are food insecurity or security, depending on how you talk about it. What we've already talked about of family caregivers and their support, availability of the workforce, which we know is another subgroup, access to transportation also being addressed in another subgroup, memory care, and comfort with technology. And as I just said, and I'll bears repeating, we can't, in our discussion, we really couldn't seem to get away from the key issue of workforce right now. And that would be, if wasn't being tackled elsewhere, a recommendation from our group, that family and caregiver support, and then also reimbursement, which we've also talked about. And listening to the Joint Finance Committee earlier this week, hearing about where hopefully we can invest in the state. And so reimbursement rates for also, paid services was really a big discussion on our radar. And then we dove into our highest need, and I think where we're seeing some great impact. And Carolyn shared with us a good bit about the work that's happening through Modern Maturity, Meals on Wheels. Melissa also shared with us all the great work at the state. The programs that have been put in place in the last few years or bolstered that have really made a difference for individuals in providing meals to them. And the great work that the volunteers are doing in connecting with individuals in their homes, in the community, how they're able to connect back with nurse, case managers, and identify where those needs are. And a great opportunity, maybe a recommendation that might come out of our committee, is to both bolster and continue those sort of programs, but also look for, just like we were talking about, Wendell was mentioning, where can we support both our volunteer communities, where in the past and where we might have an opportunity where we had seen, I think it was DHHS supported employees to go and volunteer. We might look across the whole state and say, look, we can use help in this area. Where can we volunteer, both state and private partnerships as well to generate help and support for this. So we spent a good bit of time on that. And then we'll be looking to meet early in March again and really dive into the discussion on racial and disparities and health equity. I want to thank Will and the rest of the support team for bringing forward some great data for us that we're going to look at. And I think that'll be real important for us as we talk about that whole spectrum, across our state and across home ownership to renters, what we might, areas we might target, especially for some of these programs. So I will pause there and apologize for being off camera, as I will drive safely and not touch my phone, but would like to turn to the rest of the committee and see if they had any comments to add as well.
Chris, thank you. That was a wonderful, thorough report. I deeply appreciate it.
Thank you.
It looks like we do have some questions and comments for you. So let's start with Carolyn. Carolyn Fredericks, I see your hand is raised. What would you like to add, Carolyn?
I just wanted to say, number one, I think if we did a count of statewide, I'm sure that we have served over 1 million Meals on Wheels, which is quite a mark when you look at all the various funding sources, because I know the Modern Maturity Center this past year did 425,000, and we're just one of about 4 nutrition providers. So when you add all that together, I think that's a number that we want to tout, that we really, we're fighting for the food security of the people that we serve. And so I think that's important that we do that. So I just want to, and I also want to share real quick, I know Melissa's going to be a part of it, but March the 24th, we're celebrating the 50th anniversary of the Meals on Wheels program here at the Modern Maturity Center. We've invited legislators and leaders, community leaders to come and either deliver or help us pack a meal. It's important. It's a 50-year-old program, so we need to recognize that, and hopefully we'll get money for another 50 years. Thank you.
That's great to know, Carolyn. Can you tell us what, so that's, please sign me up. I'd love to join you. What time and what do people need to do to let you know that they want to attend?
Okay, so I will put your name down.
Okay.
And I will send you an email. And usually what we'll do, we're asking you, do you want to pack the meal? Do you want to deliver the meal? And I think, if you come in and pack the meal, you're going to be very surprised at the process and how many meals we have to pack here in a very short period of time. And then we'll assign several meals. Maybe you'll deliver 2 or 3 meals. So I just need to know kind of what you want to do. It'll start around about 9 o'clock.
Okay.
We'll have a rally about 9:45, and everybody needs to be out of here by about 10 o'clock if they're going to go and deliver meals.
That sounds awesome and sounds perfect because it's a session day. So we have to be in Leg Hall by 1 o'clock or so. So I am free all morning. So as soon as I drop my kids off, I'm driving right down to see you. So we can follow up offline on that. And I'd suggest and offer that opportunity, right, Carolyn, if anybody is interested, that they should send you an email and wonderful. Happy anniversary to Meals on Wheels. That's tremendous.
And we just had a company do a day of service, and it was eye-opening for them. Advantech, I don't know if you know them or not, but they're a well-known company in the area. And what they decided to do is do a day of service. So they shut down all of their work sites and they came here for a day of service. They brought all their trucks, which they had 30 trucks. And they bought all of their employees. So they had about 70 employees, and they delivered all of the Meals on Wheels in Kent County on that day. Wow. And they were totally amazed. And I think that's, maybe we're not telling our story good enough, because they were amazed at what we do and how many people we serve and everything. So it's really important that we get the community in here to help do that just for a little bit for a day so they'll understand.
I agree. Do you know if you're working on a resolution for the House? Or if not, I'll make sure we get that started. I'll take care of that. And maybe I work with Senator Bonini and Senator Montavinos. We'll do a joint resolution honoring the anniversary of Meals on Wheels. So
absolutely.
Senator Bonini.
So first of all, absolutely. And I learned long ago, just do what Carolyn tells you. I've learned that long ago. But Chris, and I apologize, I know it's not my subgroup, but when you talked about the disparities, I think Del State has a lot of folks, I know that Dulce either just got or is getting a very large grant to look at these issues in Delaware. And I think they have a center specifically designed to look at these issues. And again, I don't know if that's getting built up or if it's already on the ground, but that might be a great sort of intersection there. And my lovely bride is Associate Vice President of Research over there, as Krista knows, like totally married up. But that might be a great resource for some of that data, and also to, I know they're doing active research on that issue. I don't know if that's helpful or not.
That's wonderful, Senator. Thank you. We'd love to connect on that and see. Also, I think for our next committee meeting, we're hoping to hear from some individuals. So if we have somebody that might be able to join and help us inform the discussion, that would be great too.
Okay, I'll reach out to Melissa and see who that contact person was. And Krista, I apologize. I didn't mean to interrupt a different committee, but I thought it'd be helpful.
Oh, this is great. Thank you so much.
No, this is perfect. This is a fluid conversation. It's meant to we all have the same interest. So I'm happy to have you add anything you need, Senator. Is there anything else, or are we ready to proceed to Melissa? Any other questions for Chris? Okay, thanks, Chris. And you can shut your video off or do what you need to do and listen. We appreciate you taking the time and being in a safe spot to deliver that report. That's really important to me too. All right. Hi, Melissa. Thanks for joining us. And we have you up next to discuss, and it's also, let's see, access to support services and combating isolation. It's a committee you Representative Briggs King, who is not with us today, but you're here. We're so thankful for that. So if you could give us an update, that would be great.
Sure, I'd be happy to. And I'm going to cheat with using my notes here a little. So first of all, I wanted to highlight how much crossover we've had. And I think volunteers are clearly the name of the game here. We came up with volunteers as a big portion of what we wanted to recommend as well. So going back a little bit, we had a couple of areas that we went into our meeting on February 14th. To use as a focus. So we have improving information on resources and developing effective means of disseminating information on services. We also identified that we wanted to use community navigators for programs that partner with the state, but aren't necessarily public employees. And some examples might be navigators in places like community organizations, faith organizations, healthcare, particularly general practitioners and primary care doctors. We also wanted to encourage and promote proactive steps to aging, and within that, fight the stigma and negative connotation with accessing services and asking for help, and really looking to normalize accessing services for both caregivers and individuals aging in place. So with that as our goal, we talked through a couple of different areas that we thought that we would like to flesh out for recommendations. In the area of navigators and identifying that resources and identifying how to connect individuals to the services that are there. And that was, as it was mentioned earlier, we have a very robust system in place across Delaware, all of the different partners and providers, and a lot of people aren't sure how to access that. So similar to the other recommendations that came out, we were thinking about ways to connect people to services and make them better aware of how they can do that. We thought volunteers as navigators might be one of the strategies we can use. We can train up navigators to be in places where people are going to be, the library, the grocery store, faith communities, VFW organizations, affinity groups, et cetera, and create a training program so that people feel, those navigators, those volunteer navigators feel really equipped and well-informed to connect to individuals, share information, but also bring that information back. We acknowledge that navigators can't be a volunteer base completely. So we also talked through some paid navigators that might be the hub, where they can be a source of more information, but also somewhere to refer someone if there's an immediate need, but also to continue that training and that sense of somewhere to go and connection to what's going on in lifetime. I'm going to move on to the next area, but then I welcome some of our group that's here to add on anything I've missed. Let's see here. The other thing I wanted to point out about navigators, both volunteer and paid, are that we felt like it was important that to age in place, communities need to offer supports and connection to services that are both informal and formal, and that the most important way to do that is within the community itself, is really to strengthen that natural connectivity and community support through more information and a little more structure, so that we're really leveraging communities to help each other and themselves age in place. To the, I think, slightly related note of both encouraging and promoting proactive steps to aging and fighting the stigma, we want to encourage individuals to think about aging. And so we discussed that we might need to change the conversation on aging so it doesn't seem so scary. It's not about death and dying. It's about enjoying your retirement, enjoying your golden years, pursuing things you may not have had time to pursue before. And so we've talked a lot about different ways to not only change language that we use, but also offer more opportunities for planning in a very positive way. And certainly the idea of a public campaign where maybe we focus on the positive aspects of aging, we focus on what's possible and what you have time for now and what we can help support, as opposed to kind of sticking it under the rug and avoiding the talk. And I think this is another crosswalk from a meeting I listened in on that I think you're going to talk about later, Representative, and that's legal planning. Don't stick your head in the sand, but instead let's dive in and plan for it so that we can really try to map out the aging in place and the golden years that we want. Again, with the target, I'm reading here, offering messaging that can be done now to improve quality of life, but also help individuals identify that they could use services. And one area that we really spent some time talking about is caregiving and caregivers. And I think this is a crosswalk with the caregiving group, in that we would be interested in helping caregivers identify as caregivers. We sometimes see a wife doesn't see herself as a caregiver. She sees herself as a wife who's helping her husband, but try to name that term so that people can identify with it and therefore also access services. And we think that there's a lot of opportunity there as well to use navigators and peers that have similar experiences and can help individuals navigate through the system. So I'm going to pause there. I just went through my notes and see, Maggie, I know you were part of that group. If there's anything you want to add, I think that's it for us though.
Sure. I think one of the benefits listening to everybody sort of walk through their highlighted areas during their subgroups is that there's a lot of that crosswalking. We heard about, accessing services when Katie was talking, and, we have these great services that are out there and just getting that, available, that information to the community. We talked a lot about caregivers and those informal and formal supports, and we're hearing a lot about volunteers, which I think in our work group, while that's great in theory, there is some challenges that do come with volunteer because of the consistency, right? And we did take a look at that, and while that's a great starting point, it may not be one of the foundational areas. We may have to look at something that's a little more formal. And looking at the structure and foundation of funding, where that comes from. And that sort of then goes down into what Chris was referring to in terms of funding for providers. So I think from taking a step back and hearing everything, the good thing, what I'm hearing, is that a lot of these key issues are pretty coherent across the board in all of our subgroups, which I think ultimately will make it a little bit easier for all of us as we really start honing in and identifying, these key areas.
Excellent points, Melissa and Maggie. Thank you so very much. Does anybody have any questions for Melissa and the Work of Her subgroup or comments? Okay, well then hi, Carolyn. Yes, please.
I don't really have a question, but I just wanted to talk a little bit about the navigators and the use of volunteers as navigators. We have a study program going on here called We Care, and we have trained our people who deliver the Meals on Wheels to look for because they're there every day or they're there a lot and we're not, so they can report back to us. There's a training system where they report back to us any changes that they've noticed about the person who's receiving the meal. And then we make the referral then to the RN who will contact them or go to their home and see if they need anything. But that volunteer is the critical link because they see that person. So volunteer navigators for Meals on Wheels and other programs are extremely important.
Terrific, thank you. And so that leads to the group that I chair with Julie Devlin, which is financial and legal barriers to aging in place. And I'm going to start off at a place that Senator Bedini was discussing, which is the good news is that we have a tremendous amount of services already in place. The bad news is people don't know about them. And because of that, I think that's where we really start to stumble upon those legal and financial barriers that our subgroup is tackling. And so we've met, I think, a couple times since our last large meeting. And on Monday, we meet again during a time which we're really going to start to actually, and I would encourage all subgroups to start to do this if you haven't already, put pen to paper with your recommendation because the time for our final report will happen sooner than later. And it's always good to shop around language as we get to it. I often think of a committee I sat on this summer that was a quick task force that had to meet. It was chaired by Justice Holland. And I was shocked to see that he had his draft report and recommendations by the third of basically a 10 meeting process. And, it was so helpful because that product that we had at meeting 3, of course, changed to meeting 10, but it definitely gave us a good guide to start for. So, we're going to try on Monday to start to have at least something in writing for our members to look at, which will be that communication piece. In systems, we often see that we're responding, especially with the legal and the financial barriers part, at a moment of crisis for families, when planning hasn't been done and when people are left in moments of despair and they don't know what to do and they don't know who to turn to. And so, oftentimes we respond to that in legislation and policy and trying to fix the crisis point. But our group really seems committed to wanting to start on that and what Melissa was referencing, that earlier point in time when people aren't as overly burdened and where they have the ability to sit down and plan for their future as seniors and as living in their homes. And when does that begin and how do we communicate that and how do we support those efforts to get that work done? There are so many programs that DSAPIT has and Classy has and Delaware Volunteer Legal Services has, and we heard a great report from Adult Protective Services about the work that APS is doing, but so many people don't know about that. And so that's really critical and crucial is that communication piece about what's out there. For 2 reasons. One, for those folks that are in crisis with legal and financial barriers, but those who aren't in crisis and who are interested in making that plan. I remember a few years ago, there was some sort of public awareness campaign called Talk About It or Sit Down and Discuss It. I don't know if any of you remember that, where it was a short-lived, but it was basically like talk with your adult kids about your plans as a senior citizen, and I remember I saw something on ABC News. I think my dad, who lives states away in the Midwest, heard it too. And, he picked up the phone and told me what his plans were. And we had, or it was called Have the Conversation, I think. And so that worked in my family, and so I think we need to continue those kinds of efforts that it's okay to talk about what someone's plans are when they age and how they want to age and how do you prepare for that, and having that conversation is very important. And finally, really tying back into the community and having neighbors look out for neighbors and community organizations look out for this population, and how do we better loop in services and awareness for those neighborhoods and for, everything from like a civic association to a community center, so that when they do see someone in need, they know immediately of who to go to for help rather than having to stammer through that process. So, as it's clear from our discussions, like so many of us have overlapping themes and will continue to. So I think our report, I'm looking forward to our final report because it seems to me that it's going to be a strong report. With some good recommendations. So does anybody have any questions or thoughts on what I just said? Wendell?
Yes, one thing that came up, we have a person, I forget his first name, but I call him Mr. Bird. But Mr. Bird has really brought in some insight to the fact that, and Katie helped me out here, but he's spoken to the fact that he's been through this year after year after year. And I think that the message it's stuck with me that we do have to get something done. And I appreciate Representative you saying it's time to put the pencil to the paper and let's come up with some concrete ideas, something that's going to work, because the worst thing we can do as a committee is not to do anything. And we have to come up with some very viable solutions and move forward. And but Mr. Bird's, his comments were just, I still can't get them out of my head, because it's kind of like city government here in Lewis. You never get anything done. So we're going to not let that happen, I'm sure. So just a thought. And that program with AARP, we had It's Time to Talk, and that was for driver safety. And Hartford Insurance was a big co-sponsor of that. And that was talking to your elderly parents when it's time to give up your driver's license, much of what you're discussing. Thank you.
Certainly hard conversations, but and necessary ones, right? Thank you, Wendell. Maggie.
One of the points that, thank you, Representative, one of the points that Melissa brought up that I think is really beneficial is also bringing those conversations a little bit earlier, right? Talking about this, or, typically I think at this point when those conversations are happening, everybody or the family or that individual is in crisis mode. And so engaging in some of this a little bit earlier, but also changing the narrative a bit to talk about, enjoying this time and what that looks like, because it doesn't always have to be so doom and gloom. But in order for somebody to be a little more open to receiving either the information or the services, to come from a positive place. So that was one of the wonderful things, and Melissa did a fabulous job going through it. But that was one of the highlights from our group. Of engaging in that dialogue a little bit sooner and in a much more positive way.
Thank you very much, Maggie. That's very helpful. And so good news, bad news. Good news is here. We have a sketch, our roadmap. We have a sketch for what our roadmap is going to look like. I don't know if this is necessarily bad news, but it's like time to, as Wendell said, we got to up the ante in terms of our work product. And so our recommendation, our target final subgroup recommendations is actually going to be the end of March. So March starts next week, so that doesn't give us a lot of time, but that's we every subgroup needs to have some meetings and really get their concepts onto paper and start talking about them amongst each other to share and work on. So that will be happening. The other thing that I wanted to let you know is that this is from Spiros. Senator Matsuvinos told me this, is that a report will be distributed to working group members for review in early April, with a goal to approve the report at a final meeting in April. So we'll look at probably 2 more full group meetings, one at the end of March to sort of update on our subgroup progress together. And then again in April to approve our final report. Senator Matsuvinos also wanted to let everybody know that an age discrimination bill that he sponsored and that I am the sponsor in the House did pass the Senate. So now it's on to me. It's a workplace anti-discrimination bill in the workplace related to age. So that's in the House now. So hopefully by March, end of March, I'll have an update for you. Is there any other, so that's sort of the where we're at with our work. Carolyn, I see your hands raised.
Yes, I have a question. Melissa probably knows this answer. I don't, but before the pandemic, there was a very successful program that was called 5 Wishes. And I don't even really know who instituted that program, but I know that they had volunteers that came into the center. And the whole concept of that was to talk about life-ending issues. And there was a document that was created and everything so they could share it with their children. So I'm wondering if we could, partner with the people who did that and maybe start that 5 Wishes program a little bit early, maybe call it something. But I mean, it wasn't intimidating, the title 5 Wishes, but I don't even know who did it. I just know that before the pandemic, it was a very popular program here at the center.
That sounds amazing. Yeah, I would like to know more about that too. Thank you for bringing that up, Carolyn.
And I'm sorry that I don't, but I'm going to do some research. It does sound amazing. So we'll figure it out.
Okay, any other, is there any issues that anybody would like to raise before we move into public comment? Okay. Taylor, at this time, I think that we are ready for section 5 of our agenda, which is public comment.
Great, I can take it from here. Members of the public who are here as attendees, if you could please utilize the raise hand function now, and I will call on names in order of hands raised. And if you could try to limit your comments to 2 to 3 minutes, that would be much appreciated. First, we have Ken Bach. Ken, you can unmute yourself now and begin your comments.
Thank you very much. I appreciate the opportunity to be part of, sit in and listen to this group. Quick comment though, with regards to the caregiver workforce group. The one big issue that all of us are having is home health providers is staffing. And I know is happening at the state level too, as was testified at this week's JFC hearings. But there is demand out there that we are not able to serve. And it's not because the demand is not funded, because there are dollars that are sitting on the table right now going unused to serve people because we cannot staff it. And so I think consideration needs to be given to the unit prices that are being offered in contracts. Providers are simply not able to offer competitive wages right now to attract and retain caregivers in the paid workforce. So I think that's an important point to note, that those unit prices are going to need to be reconsidered to allow us to pay more competitive wages.
Good point.
Thank you so much. Next, we have Cheryl Hikes.
Hi, thank you so much. And I agree with what Ken has just said, and there's just so much more competition in the home health field. So many more companies have come into the marketplace, and there's the same number of people, or probably fewer people. So there's another piece of that. It's a supply and demand. We have fewer people in Delaware in the healthcare workforce on all levels. So people will need care in their home from their families. They'll need care in facilities, care in outpatient centers. But some of the things that you've talked about in this group, I'd like the working group to consider offering to people who are in assisted living or independent living in facilities. That is people's homes. So some of these things that are great, I'd love for people to be able to offer them, or people that are on their way out of a facility and back to home. Some of this planning, some of these opportunities, I think would be great to be able to offer to individuals in those circumstances. So please consider that as well. Thank you.
And I see one more hand, Verna Hensley.
Good afternoon, everyone. I'm going to just echo quickly the comments that my other two colleagues, you can tell the providers on the call, right? And it really is a comprehensive look at the reimbursement rates across all the service lines. And DHSS did a survey back in, I guess it was 2020, I'd say. And it basically is a road map for examining reimbursement rates for services across the board. So this is hitting so many different sectors of human services. And it would be great if we could get back on track with that and taking a look, basically would set the path for the state to do a systematic review across human services to know, where should those rates be addressed? When's the last time that they were addressed? It all translates down into having more adequate wages ultimately for the workforce that we're seeking. And I just truly don't think we're going to be able to create a system that meets these needs for caregivers unless we start to do a systems change, I guess I would say, in how the funding is done and really the process by which that occurs. So that's my 2 cents.
Representative, I do not see any additional hands raised.
Thank you very much, Taylor. Thank you very much, Mr. Bach, Ms. Hikes, and Ms. Hensley for your comments. And speaking about that issue. It's very important for us to address and consider as we deliberate. I also want to give a shout out to Taylor Hawk of the Senate and Senate staff, as well as DTI, for always helping us with these meetings. They coordinate. Will Leskis, they coordinate, make sure we get all the necessary materials in advance and set up our meetings. So a huge shout out of thanks to them. And I think that will do it for us today. Open it up for one more round of comments, if there are any from our subgroup our working group members here now. I apologize for my Outlook going off. I forgot to minimize that screen before we started the meeting today, and I didn't want to mess up the Zoom. So the next meeting, I won't have that happen. But again, thank you very much. Deeply appreciate the time and really effort, energy, high energy that you're putting into this, and deep care and thought. It's important. And I'm very proud of the work that we've done thus far. And I'm very much looking forward to our reports, which we'll see shortly. So thank you very much. Good luck in your subgroup meetings over the next couple of weeks, and look forward to seeing you again at the end of March at a date TBD.
Well done, Madam Chair, for stepping in there. You did a great job.